It's Monday, April 6, 2020, and here's what's happening. We have the latest on the COVID-19 outbreak and its effects here locally. Plus, new guidelines suggest that everyone should wear a mask when out in public. What masks should we use? The county's chief doctor explains.
And the sun is shining bright out there this afternoon, but that will not be lasting. Big changes are on the way for the end of the week. We'll talk about it and more as the news at noon starts now.
Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now. I'm Justin Gould. Our top story, Chautauqua County now has a total of 18 confirmed cases of COVID-19, with 4 new cases reported yesterday. The cases involve a male in his 30s, a male in his 70s, and 2 females in their 50s. In total, there is now 18 confirmed cases, with 12 active cases continuing to recover under quarantine. So far, 5 people have recovered and 1 has died from the virus. In Cattaraugus County, a woman living in the southeast part of the county has tested positive for COVID-19, bringing the total there to 9. Officials say the woman had no recent travel history, although was in close contact with another confirmed case. Officials had also reported Sunday 3 people infected with COVID-19 in Cattaraugus County now have fully recovered. Well, during an update late last week, Chautauqua County's top physician explained the different types of masks available and who should be wearing them. Dr. Robert Burke showed us the differences between the N95 mask, surgical mask, and homemade masks. Take a look.
These are in extremely short supply. If you start to just use these willy-nilly, you are going to probably, in the end, deny the use to a first responder, and if they get sick, you have no one to turn to. So these are forbidden to be used by anybody else if at all possible. You are doing nobody any good by using these. They are extremely good masks, but they are that good for a reason. They protect your first responders and your healthcare workers. As of today, I think you're going to see nationally it's going to be recommended. Now, what does it do? For you, nothing. For everybody else, something. It's going to protect your spray, your breath, your sneeze, your cough from reaching 10 or 15 feet or 6 feet away and protect everybody else in the community.
Now, on Friday, federal officials announced new guidelines saying the Centers for Disease Control and Prevention were now advising the use of non-medical cloth-based face coverings when in public. Well, this week is critical in the fight against the coronavirus, and a top health official nationwide is saying it's going to be one of the hardest time our country has ever faced. Athena Jones reports that governors across the country are now worried they don't have enough medical supplies, even as the president says there is a light at the end of the tunnel.
Experts predict a difficult week ahead for the nation.
This is going to be the hardest and the saddest week of most Americans' lives, quite frankly. This is going to be our Pearl Harbor moment, our 9/11 moment, only it's not going to be localized. It's going to be happening all over the country.
As the number of cases is expected to peak in some hotspots like New York in the coming days.
If you look at the projection of the curves, of the kinetics of the curves, we're going to continue to see an escalation.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe.
On Sunday alone, more than 1,100 Americans were reported dead.
We are struggling to get it under control, and that's the issue that's at hand right now.
In New York, hospitals are bracing for the possibility of hitting the apex of COVID-19 cases this week. Mayor Bill de Blasio warns the city only has enough ventilators and medical supplies for the next few days. This as the state saw a decrease in deaths over the weekend.
The number of deaths over the past few days has been dropping for the first time. What is the significance of that? It's too early to tell.
But in some states like Illinois and Michigan, the race for ventilators and other medical supplies has governors growing more frustrated at the federal government's lack of an early response.
If they had started in February building ventilators, getting ready for this pandemic, we would not have the problems that we have today, and frankly, very many fewer people would die.
But President Trump expressing some hope.
We're starting to see light at the end of the tunnel.
Before doubling down on what he says are the benefits to treating coronavirus patients with an anti-malaria drug, even though there is no scientific data to back up that claim.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not.
You come out here every day, right, sir, talking about the benefits of
I want them to
hydroxychloroquine.
try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it, nothing. Because we know long-term what I want to save lives. And I don't want it to be in a lab for the next year and a half as people are dying all over the place.
Athena, thank you for your reporting. Now, as of this morning, the number of cases nationwide climbed to more than 337,000. Well, scammers are reportedly targeting small businesses with fake offers to receive assistance from the Small Business Administration. The Better Business Bureau says it sees an increase in scams claiming that federal grants are now available as a form of coronavirus relief. In one example, business owners receive an email with an application from someone claiming to be a representative of the SBA. Once the application is received, the business owner then receives an approval and request to pay a processing fee that can be up to $1,000. In some instances, scammers are even hacking Facebook accounts, using them to endorse the fake services. Experts say real government assistance never requires a processing fee in advance. Authentic agencies also use email addresses and host websites using the extension of .gov. Relief to small businesses in general is only available in the form of loans. Some nonprofits and educational institutions are typically the only ones who can qualify for grants. Well, back here at home, some local retailers are limiting the amount of shoppers that can enter their stores due to the coronavirus pandemic. Walmart announced there is now a limit of no more than 5 shoppers per 1,000 square feet in their store. In the statement issued by the superstore, associates will now mark a queue at every entry and direct arriving customers. Once a store reaches its capacity, customers will be admitted inside on a one-out, one-in basis. Wegmans will also be doing something similar. The store says customers will be asked to line up outside during busy periods to control the number of people in. As customers leave, more will be allowed in. Both stores say policies will be in place until further notice. Well, hopefully everyone is having a good day, and we thank you so much for joining us here on WNY News Now as we continue to put facts over fear in our hopes to educate the public about the COVID-19 outbreak and its effects here locally. Got to say hello to Rosie. Thanks so much for joining us here on Facebook Live. Hello to Joanna. Hello to Pam, hello to Sean, TR, and Wendy. Joanna asks, when is our governor on today? Well, Joanna, he's scheduled to speak right now. And because we are trying to take a good look at the local angle, we're going to pause on his announcements today. We will keep you updated, though, on WNYNewsNow.com and on our mobile app. And then as soon as this broadcast is over with, if he's still speaking, we'll go live and bring those remarks to you. Well, let's now switch gears and get a check of our First Defense weather forecast. Chief Forecaster Dakota Hunter joins us now with that. Hey, Dakota.
Hey, Justin, and happy Monday, everybody. We kick off another week here, and hey, next Sunday is Easter, so we're getting close to it here. Satellite and radar shows you really nothing, but notice this down here in the southern tier, northwest PA. It's not really clouds, it's fog. We had some dense fog, especially early this morning, but you can see it all burning away this morning, and now we're left with mainly sunny skies across much of the area, really not a whole lot in the way of cloudiness. So to show you the fog burning off, there it is. Everybody doing good in the visibility department, 10-mile visibility. That means the fog has all lifted this morning, and again, we posted that on Twitter and Facebook this morning. It took about an hour, hour and a half to burn off since about 9 o'clock, but it's all gone. 50 was the high yesterday, 27 is where we started the day this morning. Yikes, that was a little bit a little bit cold there. 81 and 15 are in the record books for today. We're not going to break those. So here it is through the afternoon, partly to mostly sunny, if not full sunshine across much of the area. It's a mild April afternoon, light winds, 48 right at the immediate Lake Erie waterfront, spiking to 63 well inland with a northwest wind averaging about 4 to 8 miles per hour. Enjoy this because big changes are on the way for the end of the week. We'll talk about it in just a few. Justin?
All right, Dakota, thank you very much. Coming up next, we have a lot more to tell you about. The medical director of a local health center joins us live to update their response to COVID-19. Stay with us.
You're watching WNY News Now, your source for breaking news.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer, plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
With coverage that matters, this is WNY News Now.
And welcome back to WNY News Now. Joining us live on the broadcast now is Dr. Tatsum Lee with the Chautauqua Center here in Chautauqua County. Dr. Lee, thanks so much for being here today. We appreciate your time.
Glad to be here.
First off, I want to ask you, what has it been like over the past few weeks here for your health center to prepare for the COVID-19 outbreak?
As you see, everything is not usual anymore. We don't see patients directly. Mostly we go with the telehealth, means you use the video to talk to patients. And if they need to be seen, we're still seeing patients. So try to eliminate direct contact. So that's what we're doing now. We're doing a lot of telehealth.
And you see a lot of patients here in the local area. What are you advising your patients to do in addition to those who maybe will come for COVID care? It seems like there's still many people out there who need assistance outside of the outbreak.
Yeah, I think that unfortunately that normal problems still going on with people have allergies in this area, still have sinus infection, throat infection. We still have diabetes, people, hypertension. They don't take vacations. We still have to take care of them. So that's the thing that you try to work in a line that, we can handle by video, If not, we still have the people come in and then we check the temperature, make sure they're not having the COVID infection, and then we can see them.
And I would imagine that that's why it's so important that health officials are telling us that if we do feel like we have some COVID symptoms, we need to tell our healthcare provider ahead of time before going to the office, because there could be other people there who maybe, like you said, are having a sinus infection. Is that why it's so important to have these telemedicine type of resources available where you kind of pre-screen the patients even before they come into the office?
That's correct. Some people, if you're coughing, have short of breath and with fever, that is a sign of COVID infection. So, we need to know so we can prepare. We still can come in, but, so we can prepare. And as we know that, there's a certain portion of the people have the virus. They can transmit to other people, but they still no symptom. Yeah. And also, the incubation period is 2 to 14 days. Sometimes they don't have symptoms. Now they still can spread the virus. That's why it's important. We need to know ahead.
Now, we talk a lot about the importance of cooperation as well between officials here locally and the medical industry. What has it been like for your medical group to work with leaders here in the community?
We are... Right now, we are meeting almost every other day, a meeting, try to what we need. We still, have the 2 locations in Jamestown and Dakota with testing. If they need the COVID testing, we will test All you need to do is to have your physician write in the note, and then we test it. And then the report will come to your physician.
Now, speaking of that testing, there seems to be a lot of frustration with people that we've talked to about the lack of test kits available and the fact that many people in the community really want to get tested for the virus. How can you explain to our viewers the process for someone who thinks they might have COVID-19 to get diagnosed properly?
Yeah, as you know that this COVID-19 is similar to a lot of these common colds. You don't want to testing everybody with common cold. As long as you have fever, coughing, and especially come from other hot spots, we will test it. And besides that, if you are working in a nursing home, health facility, with symptom, with very little symptom, we will test it. So it's important to test all the health workers. So that's why we give, even though the testing kit are not abandoned, but we will provide all the healthcare worker testing if they need to be tested, so they can protect other people.
Absolutely. The priority has to be with, especially for those on the front lines right now, until we can find a better process to test. Early on, officials were having a hard time of keeping track of how many people were getting tested for COVID-19, and they were saying it was because healthcare providers may not have reported them to the county because they were only reporting positive cases. Now it seems like that data is more readily available as they have a better understanding of it. Do you know why there was that gap in the beginning?
In the beginning, some of them lab tests, they had the test kit and then provide them private physicians, they test it, and then they're not positive, they're not reporting. But right now, as in the Chautauqua County, we have, ourselves and the WCA also testing now. So if any, we give a check on how many people we're testing, how many people were positive, and we know, exact number of how many people were tested.
Now, what is the treatment process like for COVID-19? I know that there's certain medical groups nationwide who are trying to work to have a vaccine to prevent it, but if you had a patient with COVID-19, what would you suggest for them to do?
If you test the COVID-19 and then, right now, no officially medication approved for the test, but as in New York, we, especially in Buffalo, Collidas, and we were approved to use some experimental medication like everybody talk about, hydroxychloroquine, and also other antiviral medication too. They are used in Buffalo and as ECMC and Buffalo General. Now, I know in the Roswell Park also used that.
Okay, so for patients there at the Chautauqua Center, do you know how many people you've tested and how many people have tested positive for the virus?
So far, we more than 200 tested. Luckily, we are only 2 positive.
Wow, and I know officials are saying that, that they're urging people to act like the virus is out there in the community, but seeing the test results now and seeing that there's so many low numbers, do you know why there's only so many people who are testing positive for it, even though officials are saying you need to be careful and you need to try to assume that it's out there in the community?
I think that most of the time, I think that in here, we live in the rural area, people live far apart, and most of the people around here are pretty healthy. So maybe we had it, we don't know we had it, and then we carry the virus, but we don't have symptoms. Because, as you know, in Chautauqua, this area, we have fresh water, fresh air, so I think that helps some. And people, especially when these things outbreak and we don't travel a whole lot, not a lot of people from Asian, Europe flow in here.
Right, exactly. And
not great.
And they say it's really important for folks who, if they are experiencing symptoms, to contact their doctor for telehealth, which they could do through the Chautauqua Center. What would you kind of give advice to someone out there who maybe says, you know, I don't really have a doctor, which I know it kind of sounds crazy to me because it seems like we all kind of have a physician. But if someone needed to get and come receive services from the Chautauqua Center, what's the best way for them to do that?
We are Chautauqua Center. We serve everybody, regardless. You know, you have insurance or not. We take 100% everybody. If you don't have a primary care, we'll be glad to enroll you to our program. And if you have been in a hospital, like you come from go to visit somebody in New York City or something like that, we definitely it's a need to make sure that you're okay. If you have fever over 100.4, and with coughing, especially dry cough, and then you need to be tested. And some reports say that in rare occasions, people don't have any symptoms except they lost the taste, the taste or lost the smell. And some people have GI problem, vomiting. That also can have an indication too, but there's a rare case, but it's still possible.
All right, so certainly the recommendation then, if someone has concerns, reach out to their doctor so they can perform that initial exam.
Yes.
All right, Dr. Tatsum Lee with the Chautauqua Center. Sir, we know you're busy, and we thank you so much for your time today. It's a really important conversation to have.
Thank you. Thank you. Be careful.
Thank you.
Bye.
Now let's get a check of our weather forecast with Dakota.
Okay.
Well, we started the day rather chilly. 27 is where we started the day here in Jamestown, 28 in Dunkirk, and 32 over in Erie. So it was a chilly start to the morning, and we had a little bit of fog. So this is a graphic we showed a while back, but I wanted to bring it back to show you how does fog form. Well, what happens is the colder air starts at the higher elevations, sinks down in the valleys where it dumps itself into the lowest valleys, and that's where the cold air actually rushes down, and then we reach the condensation point, and that's where fog happens. Fog mostly happens in spring and fall, but we can have fog, especially in the summer months as well. News Now Cam shows you the mostly sunny skies downtown. We're at 44 right now at the airport. No wind to speak of, and look at that air pressure, 30.15. So when we have air pressure in the 30s, that means high pressure is overhead. Satellite and radar shows you really nothing, just the clouds, just the high thin clouds, and the fog that we had this morning really burned off, especially earlier this morning. Beautiful high pressure. There it is right there. So that's the reason why we're mainly sunny today, but this high is going to be scooting on out and allowing a weak frontal boundary to come our way tomorrow and trigger off a few showers. Here it is on Future Scan for you. Nothing through the day. So today will be a nice day to go for a walk in the park or whatever, maybe a walk in the neighborhood, get out, get some fresh air. As we head into the morning hours tomorrow, we'll get into a chance for a few rain showers. Then as we get into the day tomorrow, scattered showers on again, off again, not an all-day rain, and it's not even going to be all that heavy either, but expect showers from time to time, especially throughout the afternoon hours tomorrow, and then that clears out for Wednesday, but we may have a few showers left over. Now, the bigger story is going to be later in the week, Thursday and Friday. Big change in the upper air pattern means cooler air coming in, and cooler air means SNOW. Yeah, I'm sorry, I had to say it. But here it is on Future Scan. This is one of the longer range models. Thursday night into Friday, another storm system will come our way with a deep upper trough digging into the region, which means cooler air and enough cold air to likely produce some snow showers Thursday night and Friday, and especially through the day on Friday, we may have a few snow showers. We can't tell you how much as of yet. We don't think this is going to be a big deal, but please understand this is 4 to 5 days out, and we still need to fine-tune this. So again, but don't be surprised if you walk out Thursday and Friday and see a few snowflakes, and it's not uncommon to get snow this time of the year. The average snowfall for Jamestown for the month of April is around 2.5 inches, so it's not that uncommon to see snow in April. I had to bring you the bad news. Here we go. Zone forecast right at the immediate Lake Erie waterfront. You're going to stay in the upper 40s today, but everywhere else should be into the mid to lower 50s, especially near the shoreline. Inland areas will likely be the warmest here today. Look at you, Warren, at 62 degrees, 58 in Jamestown. Come on, this is a nice spring day with lots of sunshine to go around. The next 7 days of your life on planet Earth are coming up right now. 56 tomorrow, scattered rain showers throughout the day. Fog will start to redevelop Tuesday night going into Wednesday morning, so expect a few showers, especially through the day on Wednesday. Thursday, 44. There's our next storm system with that big upper trough digging in here. And look at that high on Friday, only 38, 45 on Saturday. Sunday, Easter, should be okay with just a few scattered showers. And Jay, we need to you know what? My little dancing Easter bunny there needs a name. What should we call him?
We could call him, I'm not even sure. I'm sorry.
If Dakota, you guys have a name, drop in the comments.
Yes, please do. Please do. Dakota, thank you. Governor Andrew Cuomo now providing his daily update. Let's listen in for the last few minutes of the program here.
Preventing that kind of disturbance and negativity and loss for the people of the state. Perspective, you know, we like to think that we can control everything. We can't. We like to think that we can fix everything and fix all the problems for people. We can't. The undeniable truth here is that this virus is a deadly enemy, and we will lose, and we are losing people who are vulnerable to the virus. That can't be controlled. That can't be fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can. Do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Don't lose anyone who you could save. That is a legitimate, ambitious goal of government. And that we have done so far. That we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. And we are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. It means that we are unified. It means that we are loving, because if you're really tough, the really tough guys, they're tough enough to show love, and because we're smart. And that's how we're going to get through this.
All right, New York State Governor Andrew Cuomo providing his daily update. News continues 24/7 at WNYNewsNow.com and on our mobile app as we continue to keep everyone updated here on the effects of the novel coronavirus. We thank you so much for joining us today. We are back here tomorrow at noon. We'll see you then.